All right, let's break down a critical obstetric emergency. Uterine inversion. It's rare, but really dangerous.
And when it happens, you've got to act fast. Getting it right away is everything. So what's actually going on here? The uterus literally flips inside out after childbirth.
Yeah, the top part, called the fundus, drops down, sometimes all the way out through the vagina. Think of an umbrella getting caught in the wind and flipping inside out.
It's kind of like that.
Okay, so doctors actually classify how bad it is into 4 different degrees of severity. Now, here's the thing. Most cases are actually caused by medical management, so they're often preventable.
Usually it's from things like pulling on the umbilical cord way too hard or way too soon.
So a really simple way to remember it is, pulling on the cord can be a huge problem. You've got to spot it fast. The classic signs: intense pain, massive bleeding, and shock.
You might also see a red mass, or when you check the abdomen, the uterus just isn't there.
And the shock can feel way worse than the blood loss suggests. It's a huge nerve reaction too.
Okay, if there's one thing to remember, it's this golden rule. Fix the uterus first. Why? Because if you take the placenta off first, you could cause a massive, unstoppable bleed. So, the management process breaks down into 4 clear, life-saving steps. Let's walk through. First up, you gotta resuscitate. Get help, start fluids, and stabilize the patient. That's job 1. Next, you need to relax the uterus. You can't push it back if it's contracted, so drugs are key.
Then comes the repositioning. The go-to move is a manual technique called the Johnson's method. And finally, aftercare. Once it's back in place, you gotta make sure it stays there.
So you see, prevention is all about using the right techniques during delivery. It's so important.
All right, quick recap. Main symptom: hemorrhage and shock. Your first move: resuscitate, then reposition.
Which leaves us with a big question. Since this is so often preventable, how can we train teams better?